Welcome to Crimes and Minds, the podcast where mental health professionals diagnose true crimes. This episode of Crimes and Minds contains discussion about violent crimes, including the murder of children. If this topic is a trigger for you, please consider skipping this episode. Also, as a disclaimer, although we are both mental health therapists, we have never treated Lucy Letby, who we're going to be talking about today. These are our professional opinions and for entertainment purposes only.
Awesome. Well, Rachel, today we're talking about Lucy Letby. So I will give a quick summary of her case. Lucy was a nurse in the neonatal unit in the UK, in England, and in between the time of June 2015 and June 2016, I believe it was, she was eventually found responsible for several deaths of babies in the unit, as well as many attempted deaths. And so this is a very unique and sensitive and honestly horrifying case. She has already gone to trial. She has been sentenced life in prison. And so that's sort of the case we're going to get into today and to discuss in more detail. I want to go ahead and echo Rachel's content warning at the beginning. This is a really tough case to listen to. I am a newish mom, and this was heartbreaking on a whole new level to me. And definitely not something I could have read about or discussed if I was still pregnant, because for some reason, it would have just hit me in a different way. So I'm just going to throw that out there. But Rachel, what are your initial thoughts on the case?
My initial thoughts were this case is horrifying, like you said, but also very fascinating because Lucy Letby does not fit the molds of a stereotypical serial killer at all.
Absolutely. Yes, that was wild. At the time, she was in her late 20s, I believe.
Yeah, she was 28, totally normal appearing. She had a vibrant social life. She was taking salsa dancing lessons. She was a normal person, a normal 28-year-old.
Yeah. I mean, she had a group of friends who have stood by her side. We watched one YouTube special. It was a BBC One special on YouTube, and it was titled Lucy Letby, the Nurse Who Killed. I mean, they interviewed one of her best friends, and the friend was just saying, until she looks at us in the eyes and says, I am guilty, we are going to stand by her side because we just cannot believe that this person we were so close with has done such not only a crime, a horrendous crime. And it is wild how she really does not fit that stereotype.
Right. And she's pled not guilty the whole time. So it's confusing. We have no idea why she did it.
Yeah, you bring up another good point. There was no motive really ever found. And I struggled with this when we first started researching this case and I hadn't gotten into the nitty gritty of it. I kind of was like, what if she's innocent? I don't know, something about it. I felt like I could almost relate to her on some level, being, in the same age bracket and being in a helping profession. She always wanted to be a nurse. She always wanted to work with kids. There was just something about her that I was like, I can relate on some level to that. But then the more we got into it and the more resources I delved into, I could believe it, but it's bizarre.
It is. And I think that it's truly speaks to why she got away with it for so long. Doctors reported her multiple times to upper management at the hospital, but they denied it. They refused to look into it or call the police until the very end.
Yeah.
And they still didn't fire her. They put her in an office job.
Yeah. I mean, one of the doctors that I saw interviewed again on this BBC One special on YouTube, he was just, I believe his title was consultant actually, but he was also a pediatrician, and he was horrified that he had reported this over and over and over again. I mean, I'm not super familiar with hospital systems and especially the rates of death expected in a neonatal unit. But I will say in the 7 years after she was moved to the office position and then let go from this, they had one death. So that's how rare it is that there was this number of deaths. And this consultant pediatrician was just saying how they showed emails he had been sending. All seven pediatricians who worked in this unit were constantly asking for a review of Lucy, and it took them way
Two
too long.
years, a 2 year investigation.
That is absurd. If
Yeah,
children are being murdered at that rate, there's something needs to be done sooner.
definitely.
Another thing that struck me about Lucy is that she had no criminal background.
Yeah, nothing at all. And she seems so normal. Like she had a good childhood. Her parents were very proud of her. She was an only child. They were so proud of her that when she graduated high school, they took out a full page ad in the local newspaper, just proclaiming how proud they were of Lucy. And they stood by her at trial. They were there every single day.
Yeah, it's concerning. It's bewildering.
It is. Most of the time when we talk about other serial killers, it's not a reason for killing. Like, it's no excuse, but a lot of them had really traumatic childhoods.
Yeah, really traumatic childhoods. And I mean, maybe there was a trauma there that we don't know about, that no one knows about, or no one other than her. But it just seems so confusing from the outside perspective.
Yeah. And there were no red flags, literally no red flags, except it seemed that when the babies died, the only common denominator was Lucy. So
Right.
she was changing her methods.
Yeah.
And the methods that she used, we read, were insulin injections, injecting air into the babies,
Yeah.
overfeeding them,
Yeah.
and sometimes like physical abuse.
Yeah. Oh, that one was so hard to hear. And like I said, being a new mom myself, I know how difficult that must have been. Like to overfeed a baby is really difficult. Babies are actually masters at telling you when they're hungry, when they need to eat, when they've had enough. They're way better at this than we are as adults. And so I can't even imagine what she had to do in order to overfeed a newborn. It had to be an absurd amount of milk or
Right.
whatever she was using.
Yeah, it's so just horrifying. And the question remains why the hospital took so long to stop her.
Yeah, it
They're
does.
apparently doing an investigation in England as to why that is. I
Mm,
read that they're investigating the upper management at the
mhm.
hospital.
Yeah. And I believe his title was CEO of the hospital. He has left since then, and they've brought someone new in. And I actually saw interviews with the new woman who is over the hospital. And I mean, she was just saying, listen, if I were here when one of, my upper doctors, someone with a really high title reached out about this concern, I would have met with them within 24 hours. These doctors were pushed off for like over a year in total. At one point, they really raised a red flag and were like, we need an immediate meeting. They did not get that meeting until over 3 months later, which again is just so concerning.
Right. I don't know how something like that is allowed to continue happening.
Yeah, absolutely. Absolutely. So, to give the listeners, if you're not as familiar with the case, how they got to the conclusion that it had to be Lucy, if there was no trauma, no criminal history, no motive, I'm sure people are thinking, how? How do we know? So, again, she has been convicted, which is why we can, as confident as we can say that she is responsible for this. She was the only nurse on staff for every single one of the deaths and near deaths that occurred over the course of this time. She was the only one present for all of them, according to their records. There were a few nurses that were maybe present for half of them. And by present, we just mean on duty. And then several of the nurses were only on duty for like one or two of them. So she was the only one who was on duty for every single one, which is what raised the initial red flag of she's the only one. What's going on?
And then when police finally did arrest her and they were able to raid her home,
Yes.
they found records of the babies that were murdered, like hospital records and
Mhm.
diary entries that she had that said, I think the quote is, I am evil. I did this.
Yes. They also found Google searches of the victims' families, one of them even on the anniversary of the death, to like check in on them, I guess, see how they're doing, see if there's any information out there about them. And so there was enough evidence there for sure. There was one conversation we listened to. It was a podcast. It was called How Did Lucy Letby Go from Girl Next Door to Baby Killer? It was a male podcast. And there was a criminologist on there who was wonderful and had really interesting insight. And one thing he said was that the journal entries and the files that she had saved, right? That those were really looked at as a trophy. In many cases, we see trophies as maybe more physical objects from the victim, whether that's a watch or hair, even. But in this case, it was the records and the journal entries.
And I thought it was so interesting that they mentioned that she had a shredder in her room, but she
Yes.
was so confident that they would never get to her, that would never prove her guilty, that she just kept a hold of the records. And if they hadn't found those, maybe she would have been found innocent.
Wow. That's such a good point. That actually, the criminologist who was on that podcast, also to that point, was saying that points to some level of narcissism, which I found fascinating. I think it's true. I agree with that as a mental health professional, that she was so confident that she was better than the system, that she would never get caught, that she didn't even bother to shred evidence when she had a shredder in her bedroom.
Yeah, definitely.
Yeah.
And then she still has made no confession to police. And she apparently has an upcoming court date, which is permission to appeal the decision of the trial. So,
Oh,
yeah, that is April 22nd, which is why we decided to do this case and why it's so relevant, even though it's gotten very little attention in the United States.
yeah, that was one thing that was surprising to both of us, I think, researching this case is, I mean, this case is massive from my understanding in Britain. And a lot of times, like American serial killer or high level crime is very popular, for lack of a better word, other places as well. But the fact that this just hasn't blown up in the same way in the US, I don't know why, if it's, just different healthcare systems, it just looks so different, I guess. But it's fascinating because it is a massive case in the UK right now.
Right. And I also did want to note that she was reported to be cold and removed during the trial, and she did not express emotion.
Yeah.
And people said she was almost robotic when she was speaking on the
Yeah.
witness.
In fact, many people who communicated with her, who just like had the experience of her in person throughout this process, throughout the sort of researching of the case, throughout the investigation they did, and then throughout the trial, have used the words emotionless and clinical. Those were two words I heard over and over again, that she was emotionless and very clinical in her response. And I found it interesting. I think this was on the male podcast, that it was almost like they put you in the shoes of someone who has been wrongly accused of such a horrendous murder. Would you not be screaming and saying, we have to find who did this? It just wasn't me.
Definitely.
That was a really good point too, that she was not surprised. She was just like kind of clinical in her response. I mean, I cannot even imagine what my reaction would be. I would be knocking down walls trying to figure out who did such a horrible crime.
Totally. And when the police arrested her in her home, it was 6 a.m. She went very calmly. And when they handcuffed her, she went into the police car, no struggle, didn't ask anything. And then, not sure which documentary or which might have been Channel 4 News, they had footage of her interview and by police. And she was so soft spoken and she did seem robotic, but you would never guess that it was her.
Yes, I also heard part of that interview as well. And I had to turn up the volume on the device I was listening on. I mean,
Yes.
she was so soft spoken. which I don't know, that just doesn't sit right with me for some reason. Maybe she was feeling really fearful and timid. I don't know, but I found that fascinating as well.
Right. And then another thing, she claimed to have post-traumatic stress disorder from the arrest, which was not a dramatic arrest. Nobody threw her on the ground, nobody injured her, there wasn't a SWAT team. It was all very civilized.
Yeah.
And I don't see how that could result in PTSD, but she claimed that. And
Yeah.
due to that, the
Mhm.
judge at her trial allowed her to enter the courtroom before anyone else to be on the witness stand. And she claimed that it was because of her hypersensitivity from
Yeah.
the PTSD and hypervigilance. Also, some of the experts that were on the podcast said that it revealed more about her than she expected it to, and it speaks to her need to be in control and
Yes.
traits of narcissism.
Yeah. Again, coming back to narcissistic personality disorder, as someone who treats PTSD every single day, I was really perplexed by this. She did not appear to be someone who was suffering from PTSD. She claims hypervigilance, which is absolutely a symptom of PTSD. She claimed things like high anxiety and all of these things that, yes, are absolutely symptoms of PTSD. She did not appear to have those. Now, things aren't always as they appear. There are many people I treat who are really good at masking their mental health struggles and their symptoms of PTSD. However, in a situation like this, that is so extreme and so the end result is so big, right? Lifetime in prison. I don't know how she could not be showing these signs if she truly had PTSD, which does point to someone without the capability to feel certain emotions.
Right. And that seems like it would indicate antisocial personality disorder, which
Yes,
is, what psychopaths are called these days.
yes, absolutely agree with that. That is the only conclusion I can come to in all of this. And I think the narcissistic personality disorder also is comorbid there, is
Yes.
also appearing in addition to the antisocial personality disorder. Again, we've never treated Lucy. We've never had to officially diagnose her for any reason at all. This is all just as professionals, our take on it.
Yes, definitely. Luckily,
Yeah.
we have not had to treat someone like this, but it is interesting to use our professional knowledge to create entertainment and just
Yes.
speculate on what could be the case with her, what is going on behind closed doors.
Absolutely. Yeah. An aspect of this case that was, of course, just heart-wrenching was hearing some of the victims' families' response. I mean, in the BBC special, there were parents of one of the babies who was murdered. They had their voices changed and their face blurred out. So we don't know who it was, which I think is really wonderful that the court allowed that their names are sealed. There's no public record. However, they were on this interview and one of the families had twins where one of the twins died. The other one, there was an attempted death, but the baby survived. And they were just talking about all of the complications that baby has had since then. My understanding was there is no medical evidence other than trauma that why the baby is having this developmental delays and things like that. I found that really obviously heartbreaking and interesting. And it just goes to show like, listen, it is scientifically impossible that this baby intellectually remembers this trauma. And also, our bodies remember trauma. And so, even though the baby will never intellectually remember it as a specific memory, obviously the baby knows, what now the young child knows just in their body what
Right. So
happened to them.
scary.
Yeah. I have read research before that says it's something to the effect of if a baby's basic needs are met in the first 6 weeks of life, if they're fed when they're hungry, if they're changed when they need a diaper change, if they feel some sort of attachment to a caregiver, their resilience throughout life goes up exponentially so. Those first 6 weeks of life are so important to our development and our lifetime resiliency. And so for this to happen in those first 6 weeks, I can only imagine the effects that that child will continue to feel.
Right. And there was also a set of triplets, so rare, she killed two of them.
Yes. And a lot of people hear that and think, or at least I heard that initially and thought, well, the rate of mortality, unfortunately, is much higher for multiples than
Mhm.
for a singular pregnancy. However, I mean, multiple doctors went on the record saying, no, these triplets had no reason to think that they weren't going to make it. I mean, for being triplets, they were very healthy. There was no reason to think that they wouldn't make it,
Right.
which
Yeah,
was the
so
case with every single death in this case.
definitely. And there were seven deaths that she was convicted of, with six more attempted murders.
Yes. And I believe she was not convicted of all of the attempted murders.
Right.
There was, I believe, two of them that the jury just came back and said, we don't have enough evidence or something like that. But the others, she was.
Yeah, and they are starting an investigation into all 4,000 babies that came through that hospital while Lucy was employed there, which has got to be so much work for investigators and
Yeah.
detectives.
Yes, and I was also reading or hearing on one of these resources we're talking about that she had worked at another hospital previously. I don't know if it was as an intern or as a nurse when she received her degree, but there were also a slightly raised amount of deaths in that hospital during her time there. And so those are ones that are not included in this official case we're talking about, but they are now doing an investigation into those as well.
Yeah, so horrible.
So
Oh,
horrible.
and then so we said she was given a whole life sentence.
Yes.
And what I thought was interesting as well was that she refused to go to sentencing. And they
Yeah.
allowed that. They allowed her to stay in her cell and not have to face the parents of the babies that she murdered and not have to face the judge when he gave her the sentence.
Yeah. I was so, I mean, for lack of a better word, pissed off with
Yes.
at this when you think about the families of these babies who were murdered.
Mhm.
This was their one opportunity ever in their whole lives to look at her in the eyes and tell her how they ruined their lives. And the judge allowed for her to not attend, which was just so ridiculous to me. I'm
Yeah,
not sure I understand. Again, this was in the UK, so I'm not as familiar as the court system there, obviously.
that would
Um,
never fly in the US.
that would
Never.
never happen. Yeah. Another thing I found fascinating, you mentioned Rachel, she was sentenced to life in prison. And it got me thinking about like, if this had happened in the US, what would the outcome have been? And we can never say for sure. We're not professionals in the law, we're not experts in the law. But just from the basic knowledge that I understand, there are, lots of states in the US who still allow the death penalty.
Yes.
And I found it fascinating on the podcast that they were talking about this life in prison is apparently a kind of rare outcome in cases in the UK.
Yes.
Um, it wouldn't be so rare here, especially for a case of this magnitude, would not be rare at all. In fact, I think depending on the state it would have happened in the US, I think there's a good chance she would be on death row.
Right.
And I found it fascinating. They gave some numbers, and I did some of my own research that there are only 66 people in all of England currently on a life term in prison. This was numbers in 2023, so maybe just over a year ago. These were the numbers. 66 people. Now, I understand America has a much larger population. However, I looked into some of America's numbers. Again, this is as of 2023. In America, there were over 2,000 people on death row.
Wow.
Um, Now, America is about 5 times the population of England. However, the number 2000 is about 30 times the number of 66 people. So when you just think about it that way, it just goes to show how rare this case is in a place like the UK. Again, many people in America, I'm sure, on death row who are innocent, who I'm sure at the very least, death row may be a really harsh sentence. And again, I was just like amazed at how unique this case truly was in the UK, even more so than it would have been here, I think.
Yeah, I completely agree with that. And also, I just wanted to mention that in addition to the trauma and the life-lasting impact that her actions have had on the infants she murdered and their parents, I can't imagine being a nurse in the same unit as her. Like, they must feel
Yes.
absolutely terrible.
I cannot imagine. I mean, finding out a colleague has been such involved and responsible for such a horrible crime.
Yes,
Um, I cannot imagine truly. I've never even considered any colleagues to be considered in anything that would be so criminal and horrible and unethical.
right. I could see how that would really just impact them emotionally and psychologically.
Yeah, absolutely. Also, just something about not knowing, I think would have been traumatic. I read evidence that was provided of Lucy sending text messages to her colleagues, trying to brainstorm with them why they were experiencing these deaths at the time and knowing she was responsible for them. I just can't imagine being the person on the other end of that type of gaslighting and that type of deceit.
Yeah, I could see how that would cause you to lose trust in your own instincts.
Yeah, absolutely. And many of the doctors who eventually really were fighting hard to get Lucy out of the neonatal unit and to be investigated, even initially at first, they didn't give her much thought at all. They were just like, no, it surely can't be her. It wasn't until there were more and more deaths occurring that they were like, okay, we have to put a stop to this.
Right.
Such a unique case, so rare. I mean, one of the criminologists that was cited on all of these resources was just saying how rare a medical professional case is like this, like to have the medical professional be the criminal in all of this, be the one responsible, is extremely rare.
Yes, he
Um,
said that he wrote an article about
huh?
this, and between 1977 and 2009, there were only 16 cases of nurses who killed found throughout the Western world.
Whoa.
Yeah,
That is wild. I mean, the fact that and correct me if I'm wrong, but I believe many of those cases were like one-offs or two-offs where maybe they had intentionally killed a couple patients, but seven patients and then at least four, if not six more attempted
yeah,
is quite different and all within 1 year about.
yeah,
I went from one extreme to the other while researching this case. Initially, I was like, surely it's not really her, right? Like, surely. And because this case hasn't been as popular in the US, I actually had the unique opportunity that when we started researching this, I went in with very little information. And
same.
so I kind of started with the timeline of how it happened in real time because I just like wanted to have that experience. And the outcome being that I at first was like, surely not, surely not. And then by the end, I was like, just flabbergasted how horrible this is.
For sure. And the criminologist also said that she is an outlier because she didn't make people anxious. And that's
Hmm,
why she was able to continue the killing.
interesting. What do you make of all of this as a mental health professional of her unique ability to not even be suspected for so long?
I think that definitely speaks to narcissistic personality disorder,
Hmm.
as well as just this antisocial personality disorder.
Hmm.
But there were no red flags really with her.
Yeah. Yeah. Not until the evidence that eventually came forward, but
Right.
nothing leading up to the investigation.
Yeah, I think one of the doctors was quoted as saying, "Oh, not nice, Lucy."
Wow. Oh my goodness. I remember one of the families also even said they felt like they knew her. And I remember feeling this way too in the hospital after I had my son. You really bond with the nurses who are taking care of you and your baby. I mean, they were all just superheroes and incredible and so patient with me and so helpful and understanding and you really bond with them. I still to this day, almost a year later, remember their names, remember their life story. Like you really bond with these people. And so to then hear one of the families say, when they found out it was her that was being investigated, they were like, what? Like, that makes no sense. The mother of the baby was like, we kind of became friends. Like, we chit chatted and we checked in on each other. And to then hear that she was responsible for the death of their baby, I cannot imagine.
Right. But it eventually took 8 years to confirm her as a killer.
Yeah, so all of this happened for the most part between 2015 and 2016.
Yeah.
Um, she was just sentenced to her life in prison in, I believe it was August
August
of
2023.
2023. So we are currently recording this at the end of March 2024. So that was not that long ago. I mean, just over 6 months ago. So the fact that it took them so long, I don't know what to make of that. I guess because there were so little red flags. I don't know. Do you have any more understanding of that, Rachel?
I'm not sure, but I think that upper management did not want to make the hospital look bad. They didn't want to cause a stir publicly, but
Yeah.
the
Mm,
NHS definitely needs to examine how the events unfolded and the
mhm.
hospital and the administrators there.
Yeah.
Because if they took the doctors who first reported her seriously, that might have prevented most of the killings.
Yeah. Which says a lot.
Yeah,
I was reminded, and multiple of the resources I looked into were talking about how, as professionals in the helping field, especially the medical field, also for us as mental health professionals, one of our duties is to do no harm. And that's a lot of what ethics within our fields are called back to is what was the intention of the provider? Was it to do harm or not to do harm? 99.9% of the time, that's a really gray question, right? Like it is really difficult to know what someone's intent was to do harm or not do harm. This is obviously a situation where the harm was so blatant. I mean, we are not talking about someone who accidentally gave the wrong meds to one patient,
right.
because that would be a situation where it was like the question would be there. What's the intent? This was so specific, so blatant, her intent, which is, again, incredibly rare in this field.
Right. It was completely diabolical, just
Yeah,
like the most evil thing you could imagine.
absolutely. Yes. I mean, listen, there were many people who knew her, who were her colleagues, who were interviewed and talked to throughout this investigation. All of the footage I watched of that, they were all in tears of we tried and we tried to figure out why these babies were dying and we just couldn't figure it out. And then to know that she's being questioned for it. And I believe it was reported that she cried twice throughout the whole trial, both times. And the trial lasted 10 months. Okay. There was only twice that she cried. And once was when they showed a picture of her house for some reason. She cried then. I can't honestly remember the other time when she was shown crying, but it was a similar thing where it had nothing to do with the victims at that point. Again, there is no empathy there, which is so clear. And I agree with you, Rachel. It continues to point us to antisocial personality disorder.
Right. So for that reason, we would not give her post-traumatic stress disorder diagnosis. It
Yeah,
would just be that psychopath antisocial personality disorder.
right. And again, there's no evidence of trauma, nothing we know of or have heard of. Even though she claimed it with the arrest, I personally watched the arrest. You can watch it on YouTube. Very calm. In fact, at one point, the police officer is putting her in the back of the car, and I guess Lucy had just had knee surgery, I believe it was. And the police officer was just kind of honestly, like gently helping her get in the car. And Lucy said to them, "Oh, please be careful. I just had knee surgery." And the police officer was like, "Oh, I'm so sorry," and helped her in. Like,
Wow.
that is how not traumatic the arrest was seeming to
Hmm.
us.
Right. Yeah. I think she's trying to grasp at any straws she possibly can.
Yes. Yeah, absolutely. Many times in these cases, once there's, such an intense investigation, people come out of the woodworks, kind of. Old high school classmates, old childhood friends who are like, yeah, I remember one time this person did something that was very bizarre and not called for. There was none of that with this case.
I think that's why it makes it especially terrifying.
Yes, absolutely. So many things make this case so especially terrifying. So we both came to the same conclusion. No PTSD that we would be able to point to specifically as professionals. We can both agree with many of the other professionals who have put their 2 cents out there, the criminologists, there was a psychologist I heard, who all continued to point back to narcissistic personality disorder. I want to be clear though. Listen, we hear that term a lot in our culture. That does not indicate someone who is a murderer, who is
Right.
capable of something like this. It comes with its own slew of social issues. I understand that. That does not equate murder. It would be the antisocial personality disorder that it more hones in on the lack of total empathy that would be able to commit such a horrible crime as this.
Right. And the complete disregard for human life.
Complete disregard. Yeah. And such an innocent. I mean, that's something that I'm very aware of in this field. I'm kind of speaking for you, Rachel, because I know you are as well, but is vulnerable populations, right?
Yes.
Working with vulnerable populations. And that could be many different things. One population that will always be a vulnerable population is children, because they're unable, especially babies, but all children, unable to like speak up for themselves in the same way that adults can. I mean, their brain just isn't developed enough. And so the fact that not only were children the victims in this case, but newborn babies like really brings
Yeah,
it, I mean, to a whole new level.
definitely. I can't agree more.
Yeah. Anything we missed, Rachel? Anything that comes to
No,
mind
I
for
think
you?
I mentioned that April 22nd is when she gets to
Yes.
ask permission at a court date to
Yeah.
appeal the conviction.
Yeah.
So
Yeah.
I will definitely be watching the BBC at
Same.
April 22nd
Yep.
and watching this case avidly.
Yeah, absolutely. I am very curious to know how the judge or whoever will respond to this. And I'm curious to know if she shows up for this process. Like, given that she didn't show up for the sentencing, I don't know what to expect, but I'm very curious about it for sure.
Yeah.
Well, thank you so much for listening. Again, if you're interested in any of the resources we're referring to, highly recommend the podcast Lucy Letby, The Nurse Who Killed by BBC One, and How Did Lucy Letby Go from Girl Next Door to Baby Killer, the male. So, highly recommend both of those. If you or someone you know is in need of help, please call 988 to access the National Suicide and Crisis Line. For additional resources, please visit NAMI, NAMI.org.
Thanks for tuning in, everyone.
Thank you.